Physiotherapist based here at Riverside and also a clinic in the coastal patch of Felixstowe. I work for AHP Suffolk, which is a self-referral service. We see a plethora of musculoskeletal conditions. One of the things I wanted to improve on was my hip and management of hip pain patients, essentially.
Yeah. I think you came back 3-4 years ago,
yep.
And I've seen sometimes many patients, many physios repeat it. What made you to sort of repeat the course again? You know?
Just for clarity, because obviously with weekend courses there's so much great content, but it's difficult to consume it all. So sometimes, just to get further clarity on the stuff you may know and stuff that you might still be a bit unsure of.
Yeah,
it's definitely something that I would suggest. Really, it's been really helpful doing it a second time.
There's so much information there, and sometimes you have to consolidate that. So what are things? Obviously, we went through a lot of stuff with all that, but what sort of things which sort of stands out to you, which sort of could help you potentially in your practice and going forward?
Well, definitely the layered approach that you've gone over, especially thinking of different presentations and how you would maybe keep it a lot more simpler. Your approach to maybe different pathologies or presentations given on maybe some of the hip profiles that you've discussed about, especially the subjective approach maybe to kind of differentiate between an FAI, for example, some of their AGs, their EASers, and finishing off for this second part, looking at some of the rehab as well as a graded approach, because I think that's where it's difficult, is knowing the right approach to get someone back to where they want to be and maybe rushing it too quickly. So having a nice sort of initial stage, so their stage one, and then having a bit more of a blueprint, as it were. It's been really good, really good.
So there's a big emphasis, as you know, on the course on the real hands-on and the practical application. As you know, just not the theory. You went through the manual techniques, some soft tissue work, and also you are a lot on the rehab side. So how much do you think is those sort of real techniques and I think can be applied to the patient group you're working with?
Yeah, very much so. So we probably see a lot more of our degenerative hips more than the FAIs, I guess, in this type of location, given that it's self-referral, not essentially private. So yeah, there's definitely a lot more additional things that I feel that I can now help with some of our degenerative hips, looking at some of the soft tissue work and the manual therapy we may have looked at, as opposed to just the bog standard stuff that we might normally do.
And the rehab, obviously that's so important. So different stages, how do you find those sort of exercise variety and all those things we went through?
Yeah, really good. So that now just not having a maybe an exercise you might give to most hips, at least now it's giving a bit more of an appreciation of keeping it quite bespoke to the presentation, and now with a plethora of approaches to some of the more hip external rotators as we've looked at, as opposed to the hip flexors, being really valuable.
Yeah. So moving forward, like with all the knowledge, and you got the book, so you're going to look into that. How are we going to sort of move forward? What's your how do you see your progress in that sort of journey in your hip and groin? Is it something you feel confident now to explore? Obviously, you need to do your own reading and all that. Do you feel a bit more confident in that sort of make your own judgment and things like that?
Oh yeah, definitely. Like I say, the approaches you've gone over has been really great, especially with our maybe our more junior staff having a bit more confidence to also help their tricky cases alongside yours is now also really good.
Yeah. So finally, regarding attending my course, what would be your sort of suggestion?
Yeah, not to hesitate and just book up. It's been really good. If hips and groins and differentials is something that you're struggling with within your practice, I think it's a very important course to do. It definitely provides a lot more confidence leaving the second day, definitely.
Yeah, okay. Brilliant. Thanks, Josh.
That's all right.
Yeah,